viewers and listeners. You're welcome to the Maiden edition of the Health Corner. The Health Corner is a documentary series powered by the Media, Publicity and Awareness Committee of the Nigerian Medical Association, Enugu State. Today, we're going to be focusing on the World Sight Day. World Sight Day is annually celebrated on the second Thursday of October to create awareness on eye care and eye health. Today, we are being joined by the Young Ophthalmology Forum of the Ophthalmological Society of Nigeria. My name is Dr. Ozamake Enugu, the Publicity Secretary of Nigerian Medical Association, Enugu State. And with me today is Dr. Nnenna Ozioko with the Enugu State University Teaching Hospital, Parkland. You're welcome, ma'am.
Good evening, everyone. Thanks for joining in.
Again, Dr. Ndubisi Amo, a consultant ophthalmologist with the University of Nigeria Teaching Hospital, Ituku Ozala. You're welcome, sir.
Good evening, our viewers. Welcome.
Okay, so we all know that eye is one of the sense organs, and we need to take care of it very well. So our members have actually sent in questions, which we are going to be asking, and the panelists are going to help us to, talk about them. The first question we have here is on eye check. What does eye check mean, and what does it comprise of?
Thank you, Zamaka, for that question. So an eye check is a series of tests you do to determine how the eye sees. So there are two types. You can do a fast one, which is an eye screening. Then you can do a comprehensive eye exam. So the eye screening is done to just determine if the eye has any major problem at the moment. So after that, you also need to see your doctor if it is found out that there's something more serious. So otherwise, you can now go home and then eventually check your eye yearly. So a comprehensive eye exam entails checking the eye externally and internally to make sure it's functioning very well and there is absence of any eye disease. So the components of the examination include the visual acuity test, which is the basic eye exam. Then also you test the external eye. External eye usually tested with the aid of a slit lamp in the ophthalmology office. Then the ophthalmologist, talks to you about how you're feeling about your eye, takes a general history about you and any other problem you may be having that is not even related to eye. A complete history is usually important. Then after which a dilated eye exam is done. So this is a major difference between the comprehensive eye exam and the screening. The screening test is fast, so you don't have time to dilate the eye. So you just look, a fast one. But here you're dilating to check it and make sure and make a diagnosis. So the diagnosis is not made in the screening test. So the eye is checked from anterior to posterior. So after the visual acuity, which is a test to determine the level of vision in the eye at the moment, you check the lids, the conjunctiva, the cornea, the lens, the inner eye, which is vitreous, and then the retina, which is where the eye focuses to see. So there are other specific tests that can be done, which are indicated if from the history you think it is necessary. For instance, the patient who you think might have a glaucoma should also go ahead and do gonioscopy and then check the optic nerve head very well with special lenses to know if truly there is evidence of glaucoma. Then you could also do the OCT, pachymetry, and other tests that will determine the visual function. So generally, the basic eye exam is more comprehensive. Then for children, it's also different. So these ones I've talked about are for the adults. For children, they need to be more care needs to be taken in determining their visual acuity. They need to check their ocular motility because they are more prone to birth defects. You need to also check the ocular motility test to help you to know if the eye is straight or if there are other problems. Then you do dilated eye exam for them. So basically, this is what an eye check comprises of. Thank you.
Thank you very much, Dr. Uzioku, for that. The next question, which is talking about the frequency of eye checks. How frequent can one do these eye checks? Dr.
Well,
Amo.
thank you. In doing eye check, it depends on, you have taken a history before doing a comprehensive eye check. When you have a history, when someone has a family history of a particular disease, like people with glaucoma, they are required to do their eye check every 6 months and do some certain tests to make sure they don't have glaucoma because they are at higher risk of having it. Also, the frequency also depends on what you're suspecting from your history. Apart from that, everybody is supposed to check his or her eyes every year, at least, to make sure there are no pathologies developing. Then in children, especially preschool children, they're supposed to do an eye check before entering school, because some of the problems in children, like amblyopia, may develop if one didn't know the child has a problem. So it all depends on what you're suspecting or what you think the child has, the patient has, someone you're seeing has. Again, people with diabetes, they are supposed to check their eyes at least every 6 months, depending on the stage, because there are different stages of diabetes. We have the proliferative type and non-proliferative type. So someone that is just newly diagnosed of having diabetes is supposed to do an eye check and do it every 6 months to 1 year to ensure he doesn't develop diabetic eye disease. And also, diabetic is very important because diabetic eye disease is also a pointer to other things that may be happening to the person. Someone with diabetic eye disease can have renal disease, can have heart disease from this. So there's need to always check, especially every 6 months to 1 year, to know if there are things that are developing that are not acceptable. Basically, I don't want to put date to the different eye diseases we have, but at least every 6 months, one should go to an ophthalmologist and have a dilated fundoscopy to be sure things are going on well in his or her eyes.
Okay. Thank you very much, Dr. Amo. So in essence, we are being told to do our regular eye checks. 6 months. It also depends on the type of eye care or eye disease that one has. So check your eyes regularly. So we are moving on to the next question, which is on refractive errors. The person asked the question, what are refractive errors? Dr. Uzioku.
Refractive errors are a group of defects in which the eye is not seeing the way it's supposed to see. So sometimes it's said to be inherited, or sometimes it's said to be as a result of the age of the patient, the age of the person, and then also sometimes it's due to the lifestyle. So these have been the different causes proposed. So we have the 3 types: the myopia or nearsightedness. Nearsightedness is a condition in which the eyeball is too long or has excess power, such that images are not focused on the retina, which is the camera of the eye that allows light into the eye and images to be focused. So we also have the far-sightedness or long-sightedness. It's also known as hyperopia. So it's a condition in which the eye is too short, so images are focused behind the retina. So there's a third one also, the astigmatism, in which the curvature of the eyeball, the eyeball is called like an American baseball. So it has the vertical curvature and the horizontal curvature. So when the two curved surfaces of the eye, focus images differently, can result in poor vision, known as astigmatism. So this myopia, which is nearsightedness, makes the person to see near things but cannot see far things. Then for the farsightedness or hyperopia, patients are able to see things that are close only but cannot see things that are far. And for astigmatism, patients has blurry vision,
Distorted images.
distorted images on the retina.
It's important to add here that there's another form.
Okay.
It's not really a refractive error, presbyopia, that is very common, is associated with age. When someone is up to 40 years, it's expected that if someone that has normal eyes, that person should use glasses to read. So it's not really, in the street sense of it, a form of refractive error, but it has to do with difficulty seeing or reading near objects, near prints or objects.
Okay. Thank you very much, because this last thing you said now is very important, because a lot of people in their middle-aged individuals will complain that for men that read a lot of newspapers, they will tell you, I'm not able to read my newspapers once again. The females will tell you, I'm not able to read my Bible, and is it a problem? What should I do? So we are telling them now that it is a form of eye defect, and they should go check it out. And
It's not. We wouldn't say it's a form of eye defect per se, but it's an aging process. Just like someone that sees white hair in his head shouldn't say it's a problem, because it's part of aging.
Thank you so much. So we're going to go on a commercial break now. So don't touch the dial. Keep listening, and we'll get back.
From Media, Publicity and Awareness Committee. I'm the secretary. So we're going to ask you a few questions. Hope you don't mind.
No.
What's your name, please?
Well, my name is Ifeanyi Chibuzo.
Okay. Ifeanyi, what do you know about the eyes?
I know about the eyes vision.
Okay, so it serves as
Sight.
so you use your eyes to see, and what else?
Because at times I've gotten like something like tears during when there is Harmattan season. But now it's not.
Okay, so a lot of things could make the eyes not function optimally, and one of those diseases of the eyes, or not diseases of the eyes, that can cause blindness, it's glaucoma. Have you heard about that before? Okay.
But something can cause eye blind. They're so numerous. One is cola nuts containing nicotine.
Okay.
Second, looking television day by day, daily. Television like white color, that is
the black and white.
black and white.
Okay.
Thirdly, working under the sun day by day also can cause eye blind.
Okay, without protective goggles. Okay. So on the 14th of October, we celebrated the World Sight Day. Did you hear anything about that?
No.
Okay. So there are jingles on the radio about this day, and it's a day where we create awareness about the eye, and we talk to people about how to protect the eyes and things they should do to make their eyes better and function optimally.
Yeah.
And then we advise people to get eye checks. So have you gotten any eye check in the recent time?
No.
Why?
Because I'm not normally seeing people like you that are asking about eye problem or myopia or whatever you call it.
Okay, so you'd want to see more people.
Yes.
Okay, talk about the eyes and create more awareness.
Yes.
You mean physically and not just on the radio?
Not on the radio, because I myself, I'm not normally listening to radio. I listen to MP.
Okay, so we should do more MP things.
I don't know.
Okay, thank you. My colleague will take another question.
Thank you for the answers you've given us so far.
Okay.
I'm Dr. Enugu. So I will follow up with the questions. Uh, can you give us your final words on how you think we should improve the awareness of eye checkup and awareness of eye health in this facility?
Well, the awareness should be when you people are continue coming to this hospital, maybe 2 times in a week or once a day. That is 4 times or even 1 week to enable us to learn how to, that is away from something that can cause eye blindness. How you people are teaching us in this hospital. So now, not only in this hospital, even marketplaces and school premises. So that is it.
All right. Thank you very much for your time.
Welcome back. Today on Health Corner, we are being joined by two ophthalmologists, Dr. Nnen Nozioko with the Esut Sparkling and Dr. Ndubisi Amu with the UNTH Itukozala. You're welcome once again.
Thank you.
You're welcome back. So we're going to go ahead with the other questions that are here, which were sent in by the members of Nigerian Medical Association, Enugu State. The next question here is on school health and the child intelligence. Is there any relationship between the eye care for children and their intelligence at school? Dr. Ozioko, please.
Yes, there is a very important relationship between how the child sees and the level of intelligence. It is said that 80% of the child's learning is as a result of what she sees. So both classroom teaching and non-classroom teaching will be difficult if the child is not, learning will be difficult if the child has poor vision. So it is really important that the child sees for high intelligence to develop.
It's also important to add here that a child's ability to see also determines the developmental milestones, because if a child doesn't see well, the child may not be able to crawl when he should crawl, may not be able to stand when he should stand. Because I've seen a child that had cataracts, but the parents didn't know. The only thing they noticed was that the child wasn't really doing what his siblings were doing when they were of the same age. So visual, being able to see also helps a child in developing well.
Okay, thank you very much. So the next question we're going to go on to is, does constant use of the phone and other screens have any effect on the eye? If yes, how? Dr. Mo, please.
Yes, it does. It does, because now people don't use phone again just for answering calls. In fact, some people use phone for their work. Some people use phone for Facebook, all the social media stuff, and it's very everywhere now. So on the average, almost everybody looks at his screen, and it has effects. That screen you're seeing produces blue light, and this blue light it affects the photoreceptors in the retina. So constant use of these gadgets, the laptop, the screens, keep producing this blue light that affects the photoreceptor, and the damage the effect on the retina is irreversible. So constant use of these things affects the eye definitely, and that's why in those people, when these photoreceptors are affected, it could cause macular damages, and macula is the part of the eye where people use in seeing. So when a patient's macula is affected, which is irreversible, it has really affected the patient. Person's vision is affected.
Okay, so you're indirectly telling us to reduce screen time with
Yeah,
whatever
there are ways
phones,
to,
laptops. We should reduce screen time. If not, it's going to have
yeah.
an irreversible effect.
Yeah, but we know that these things may not be possible. You can't tell a banker to leave his job, because a banker is always on the screen doing his work. Many people live on the screen actually. So there are some things you can't just tell someone to stop. So there are things you can do. Samsung recently introduced there was a study that introduced blue there's something they
Light
introduced
filter.
white
Filter,
filter, something
okay.
like that. And also then what you can also help yourself by wearing different kinds of lenses. We have blue cut lenses, we have anti-reflective lenses. These things help in reflecting that blue light away from your eyes because you can't keep wearing dark goggles, you know. Then another way to also help yourself is to, after looking at the screen for there's something they call 20-20-20 rule.
Right.
After looking at the screen for 20 minutes, you look away and look at something about 20 feet from you for about 20 seconds. You know, that way you're resting the eye and also you're also doing what you're doing. The use of screen can also what we call computer something syndrome,
Visions. Yeah.
conjunctive visual syndrome. Because when you're looking at a screen, you're concentrating. Most time people don't even blink when they're looking at their screen seriously. So that way you're not, the blinking helps in redistributing the tears on the eye surface. So when you're not blinking, your eye is dry, and it causes irritation in the eye. And before you know it, you start having burning sensation in the eye from your work. So there are ways to do it. Blink, look away, wear protective goggles. Or there are some people who put on even on their screen, some protective screen shield, to protect their eye, because you can't tell someone to stop his work because of these problems.
So we are being told or being advised to, make use of the 20-20 rule, which you said after looking at the computer for 20 seconds
20
or
minutes.
20 minutes, look away at an object that is 20 feet away, and then
for about 20 seconds.
For about 20
Sorry,
seconds,
look
okay.
away.
Or you can actually get dark goggles.
Yes,
or
different kind of
and
lenses,
skin protective.
anti-reflective.
Okay,
yeah,
good.
yeah.
So I think these are very, very important practical ways of reducing
Helping
this
ourselves.
light. Okay. So the next question here is on: are there any danger signs and symptoms that one will see in the eyes and the person will want to seek urgent medical attention? Dr. Zuki.
Yes, there are danger signs that requires that when it occurs, you should try as much as possible to see your doctor immediately, because it could be a sign to a more serious problem. So if you have blurry vision, which is sudden, you were seeing very well before, then suddenly you stop seeing clearly, it could be a pointer to some problems in the eye that is more serious. So you need to see a doctor. If you have red eye occurring with pain, red eye could also be that you have an abrasion on the surface of your eye, which is the cornea. It could be that there's an ulcer there. It could be that there's an acute angle closure that is occurring. Then you should also see a doctor, because if you don't treat, like for instance, a corneal abrasion and ulcer promptly, you may lose that eye. The eye may develop a more serious condition, which is epianophthalmitis, and that eye may be lost. So you need to see a doctor. Then if you suddenly start seeing flashes of light, especially if probably you've had trauma, something hit your eye and then you now start seeing flashes, or you start seeing some dark specks or stringy objects in front of your eye, some patient describes as cobwebs or floaters, you should see your doctor immediately. So these are the few conditions that require us to see. Then if you have suddenly, during maybe domestic work, you splash a toxic chemical into your eye, it's a chemical eye injury, you should rush. You should irrigate first at home with clean running water, tap water, and try to see your doctor immediately. Then if you have trauma, deep penetrating trauma to your eye, you should also see your doctor.
Okay. It's also important to add here, that in children, they can't talk. When you see white reflex, that's cataract something that looks like cataract in their eyes, don't just assume it's cataract. It could be an an eye cancer, that's retinoblastoma. So when mothers see such things in their children, they should know that it's sinister. They should go and see a doctor, and then if it's cataract, it will be a simple thing. But if it's the other one, retinoblastoma, it will be taken care of early enough. Because our major problem here is late presentation in almost all the diseases. So when you see some of these telltale signs, like she said, someone like has flashes of light, the earlier the person presents, the better. Because if someone has retinal detachment, which is what she's driving at, the earlier the surgery is done, the better for the patient. Thank you.
All right. Thank you very much, Dr. Amo. This has been quite an enlightening session, if you agree with me, and it's something that we should all learn and practically use, because everybody has an eye or two eyes. I mean, everybody. So we should be able to get used to taking care of our eye. So the next question here is, what foods help to keep the eye healthy? Dr. Amo, please.
Okay. I will answer that question by saying that I don't want to restrict people from eating whatever they want to eat, really. But when you're eating, try and add leafy vegetables to what you're eating and fruits. Then there are some things, the food that are not cardiovascularly friendly. The eye and the cardiovascular system are related. Things like junks that will make you add weight, and also that will increase your risk of having diabetes and hypertension. They're not really good for your eye, because when you have diabetes and hypertension, your eye is indirectly going to be affected. So I will say that you eat healthy, eat leafy vegetables, eat fruits, and eat normal diet. Okay? The leafy vegetables will help people, even though it's not common here, people with age-related macular degeneration. It helps very well in their treatment, because essentially it has a lot of vitamins, these vegetables, so they require vitamins in their treatment. And the drugs usually used in managing them, I would say treatment, are usually expensive, because they are essentially multivitamins that are expensive. But we are here in Africa and we know how poor we are, so we need to help ourselves by eating these things that are easily available around us, which include vegetables like ugu, green, all these things. Eat them and eat healthy, and avoid junks. Thank you.
There's a study that was done, which, as you said, was trying to study some nutrients that could be beneficial to the eye. So it's the age-related eye disease study. So they found out that beta carotenes, vitamin C, vitamin E, and also zinc and copper were good for the eye. The nutrients that were good for the eye. So they also, updated that study in 2013. Found out that the macula has some macular xanthophylls, which are also found in some food substances. That's the lutein, the zeaxanthin, and the omega-3 fatty acids. So the omega-3 fatty acids, you can find in fish oil. And also eat fish, sardines, herring, salmon. Then nuts also have omega-3 fatty acids, like cashew, peanuts, and things you could eat. Then also, seeds like the chia seeds, and then carrots, as he said, carrots has vitamin C, vitamin E, has also zinc, lots of zinc. Then egg, beef, then water. You should drink lots of water. It helps to hydrate your eye as part of your body, and then by so doing, you may not have dry eyes. So these are things that could help.
All right. So thank you so much. If I can remember very clearly, growing up, even now, they used to tell us to put a lot of palm oil in our food. The lot of these days you now have palm oil gari, the yellow gari. That is even better to take that one than to take the white one and all that, because it improved eye care. So can you say anything about it?
Yeah, palm oil is rich in vitamin A, which the eye requires very well. In fact, some foods are fortified with vitamin A. These are things done to help the eye. So palm oil is very good. It's good for the eye. It has a lot of vitamin A, so I think it should be recommended.
Okay, so we should continue eating our yellow gari.
Mm-hmm.
Okay, so at this point, we are going to take a short break. But before we take that short break, when we come back, we're going to talk about myths about the eye and eye care. So don't leave us. Keep listening. Welcome back, viewers and listeners. We are still here on the Health Corner, and we are discussing World Sight Day theme for 2021, which is Love Your Eyes. And we're here today with Dr. Nne Nozioko, a fellow of the Nigerian Postgraduate Medical College Ophthalmology, and Dr. Ndubisi Amo, consultant ophthalmologist with UNTAD Tukwazala. You're welcome.
Thank you.
Welcome.
So as we all listened to the video that was just played, we've heard a lot of myths and what people think about eye and eye care. So we're going to be busting some of these myths right now. So the first one we've heard is about the use of goat eye to replace the eye when the eye has a problem. That's what, what you heard what they said. So we want to know if it's actually true, or is it a myth, or what exactly is it all about, please? Dr. Zioko, please.
Of course, it's not true, but I've heard it from a lot of patients I've seen in the past. So I just try to explain to them that it's not true. So they think that when you probably have a damaged eye that require you to put a prosthesis, that prosthesis is actually maybe an animal eye, but it's not true at all. It's made up of either acrylic plastic. The prosthetic eye can be plastic, used to be other materials like glass in the past. But of course, if it's a goat eye, it will spoil now. It cannot stay, so it's not true.
Okay, so we've heard it now. It's not. We don't use goat eyes for prosthesis. So the next question is around. The next myth is around eye surgeries. Some people believe that once you have any issues with your eyes and you have to go in for eye surgery, that it's more likely that you're going to come out with blindness. So that's why most people don't actually go to once you tell them this eye problem requires surgery, they run away because they feel once they go in, they're going to be blind afterwards.
Yeah.
What do you have to say about that?
It's very wrong. It's a very wrong notion. In fact, a lot of eye problems can only be solved with surgery. Someone that has cataract, no matter what you do without doing surgery, that problem will remain there. So these surgeries are now better done because there are better technologies. Maybe I feel that people used to run away because some of the technologies we have now were not available then. Now we have better equipment, better, well-trained individuals that do this surgery. So it's not true. When someone goes to the hospital and the person is told you have a condition that requires surgery, please accept surgery and get better. Something like glaucoma can also be operated on. People with cataract can be operated on. So the earlier someone accepts surgery, the better, so that the problem will be solved early instead of frequent going to the hospital and not getting any solution. That's why some people, after going to the hospital for some time, so in fact, it's a big problem. But some people will, after they are told they have a condition that requires surgery in the hospital, they will run away and go and meet couchers. Couchers are people that walk about in the villages, and they say that they do surgery. They don't do surgery; that they remove the lens, the cataract. But at the end of the day, the patient faces even a more serious problem because some of them will start having eye pains, added to the fact that they are not seeing. So when you're asked to do surgery, accept surgery and go ahead with your life, please. Thank you.
Okay, so these surgeries, are they the outcome? Is it dependent on the age of the person? Because I've seen young people, children, even elderly, coming for this surgery. The outcome of these surgeries, are they dependent on age?
The outcome of a surgery depends on before someone taking someone for surgery, you're supposed to have examined that person and you're supposed to have checked the visual prognosis. Because some eyes actually have poor prognosis. Before someone that has both cataract and glaucoma, end-stage glaucoma, and you're removing the cataract, the patient is not really going to see as well as he should compared to someone that has only cataract. So it depends on the prognosis, what you have, the visual prognosis of the person, and two, another place that is important is also on the surgeon's expertise. When a patient is in a good hand, patients will see after surgery. Someone like that it's also important to note here that people with glaucoma, you're not operating on the patient to see better. You're rather operating on the patient to stop progression of the glaucoma or reduce the progression of the glaucoma. The patient doesn't go blind from glaucoma. So when you're taking a patient for surgery, it's important to make all these things clear. If it's cataract, patient should see. If there are no other things that will make the patient not to see. Someone that has diabetes and cataract, patient may have also diabetic retinopathy. That after removing the cataract, you now see that the patient has something else in the retina that will make the patient not to see well. Also, someone that has retinal detachment added to the cataract you're seeing, after removing the cataract, the patient may not see because the retina is already detached. So it's always important to assess the patient very well and inform the patient about the visual prognosis so that patient that is supposed to have a poor visual prognosis, the patient doesn't start expecting magic to happen. But on a normal good eye that has just cataract, patient should see after surgery.
Okay. Thank you very much. So we've heard it now. Eye surgeries are nothing to be afraid of.
Yes.
Once you go in, you're properly examined, you can get your eye surgery and your vision can be restored. Okay, so the next myth we've heard about is the issue of, in this part of the world, there's this slang, they call it smoking white Gary. So drinking white Gary, actually. So they say that people that drink white Gary a lot, stand a chance of, going blind towards their middle ages and all. So what do you have to say about it? Dr. Nena.
I think there's no evidence that have shown that. So Gary is just one of our one type of food that people consume. So, but we know that there is this gari that is not well processed. You know, it may have a lot of cyanide. So, if consumed in large quantity over time, it may cause toxicity to the retina. Even though studies are still ongoing concerning that.
Okay. Thank you very much. So we're going to move on to the harmful practices section. Now, some of these, questions or some of these things that people do, at home or in their communities, when people have eye problems or different types of eye problems, they tell you they instill breast milk in the child's eye, they instill urine and kerosene for all sorts of eye issues, I know, of course, they sound harmful already, even without saying they are harmful. They already sound harmful. So what do you have to tell the people now, in concerning that?
This is a very wonderful question, because even some nurses in the hospitals advise these patients to instill breast milk when they're having discharges. When a child, maybe most times neonates, when they have discharge when they have discharge, their mom is breastfeeding. So when they get to the hospital, some of these people tell them to instill breast milk. Breast milk has a lot of sugar in it. So these microorganisms causing the discharge will feed on this and proliferate and cause more problems.
So indirectly, they're increasing the problem the child has.
They're increasing the problem. So breast milk doesn't in any way help in treating, even though breast milk has some antibiotics in them, but the harm it will cause is more than that antibiotic if it has. But it shouldn't be instilled, it shouldn't be encouraged. Go and see your ophthalmologist. Let the patient treat the child, okay? Because some of these discharges they have could be very something like if it's gonorrhea that's causing it. Because when a child passes through the birth canal and the mom has gonorrhea, that woman can infect the child with gonorrhea, and the only way to present in that child is eye discharge. So when a child that has gonorrhea, you start instilling breast milk, that organism will just perforate that cornea, and that child will go blind. So it's a terrible thing. So our people should know that it's not proper to instill breast milk. Okay. And some of the other things you mentioned, I can't
kerosene
no.
and urine.
You're causing chemical injury. You're instilling urine. Why would you instill urine in an eye? Okay. Urine is it alkaline now? You're not supposed to instill alkaline into someone's eyes. Okay. So it is wrong. It is wrong. Yeah.
Okay, so Dr. Nena, there's this practice among some mothers, when they give birth to child newly, they rub what you call, I don't know the English name now, so they call it otanjele. They rub it, around the child's eye, and they say it's for the child's eye to be clearer or to be whiter. What do you have to say about that?
Yes, I've seen it a lot. So it's a common practice in our area. Especially the older mommies, the grandmothers, they practice it a lot. So, but it's still not correct. The otangele, it's a form of chemical you introduce into the eye of a newborn child. So early in life, such could also cause bacterial proliferates, cause microorganisms to proliferate and cause conjunctivitis, chemical conjunctivitis.
It's also a foreign body and could trigger allergic reactions.
Okay.
Some of these people will come with frequent itching of the eye. Maybe it's from even the otangele that they're instilling that's causing the allergy. And from frequent itching, the child can even cause corneal abrasion and have more problems. So it's wrong to instill those otangele. Some of them will say it treats area, that's area in Igbo. It means allergic conjunctivitis.
Oh.
So it's not treatment for allergic conjunctivitis. It's just a wrong thing. And all these commercial people sell it. When you go to different markets, you see them carrying it up and down, selling to people. And you see people rushing to buy them. It's wrong. It's wrong.
Okay, so we've all heard it. Applying Otangele to a child's eye is very wrong. I mean, God created us in different ways. Some people's eyes are whiter than the others, so you don't have to apply anything to the newborn baby to make his or her eye brighter. Okay, thank you very much, Dr. Nena and Dr. Amo. We're moving up to occupational eye diseases. Now, walking along the streets, you will find some people, some welders, they just do their work without protecting the eyes, and you as a passerby, you're already feeling these people are in some form of danger because, of course, you're seeing the sparks of light and everything. So, and what do you have to say? What's your advice, to this? Because we want to prevent, as much occupational eye issues as possible. Dr. Nena.
Yes, people in this part of the world don't seem to take precautions, or there is no proper education concerning our occupational hazards. So we need to beef up on informing the general public about these hazards and what they can result from. So for the welders, they require to do their work wearing goggles that protect even them themselves during the work from the welder's arc, which can cause corneal burns and also more serious problems for the eye. So I think that's the question.
Yes.
Welders,
How
particularly.
do we prevent? Yes.
Okay, so it's by educating them, then telling them the importance of protecting their eyes while doing their work, and then also if by any chance they get such injury, to present to the hospital immediately, as soon as it occurs, so that something can be done to them.
Okay. Thank you very much. We already talked about some other forms of occupational eye issues, eye problems are the one we just talked about, Dr. Mo talked about earlier on, people that use a lot of screens, computers, bankers, and people secretaries, people that work on the screen a lot. We already talked about how to prevent that computer vision syndrome from occurring. So we're going to go to the next question now. People asked, are there eye diseases or eye conditions that are hereditary? If there are, how do we know which ones are they? How do we know them, and how do we, take care of them? Thank you.
Yeah, some eye diseases are actually hereditary. Something like glaucoma. Okay. There are some people that it runs in their families. There are other things like retinitis pigmentosa. There are a lot of eye diseases that you can say you can inherit it from your parents or from your relatives. So when you have such people, when you have a patient that comes with an eye disease that can be inherited, it's important to do a family screening. There's one ongoing now in UNTH. We're doing a family screening for people with glaucoma. Once any member of your family has glaucoma, you're supposed to come. We do a free screening to know if you have glaucoma. So some inheritable diseases will have them, and once any of your relatives have such disease, you're supposed to check. Something like myopia too is inheritable. Notice that in some families, you notice that everybody wears glasses. As well as some families, everybody wears thick glasses. So some diseases are inheritable. So what you need to do, once a member of your family, that's why in taking history, we ask about family history of such eye disease. Okay. So once someone has such disease in your family, you need to go check your own out. Like I said before, glaucoma, retinitis pigmentosa, myopia, and the rest of them are inheritable.
Thank you. Dr. Nena, do you have anything to add?
Well, as you said, it's through this eye screening for communities that we can, through eye screening tests, you can find out these eye diseases, like glaucoma, as you said, but actually there are diseases that are inherited, eye diseases that are inherited.
Okay. Thank you very much. So this period now, we are in the COVID-19 pandemic, this question comes up, like, COVID-19, does it have any eye symptom? Does it have any eye sign? Is there something I'll see in my eye or the layperson sees in his or her eye that will say this is suggestive of COVID-19?
Yeah, COVID-19, the scare that came in 2019. Yes, there are some reports about the ocular manifestations of COVID-19. Yes, so but it's the manifestation is just like any other viral conjunctivitis, the one that were reported. That's redness of the eye. So mostly it was conjunctivitis that was the most reported, even though there were cases of dry eyes, reported in the patients, and then also blurry vision. So, but the majority of reports had the presentation just looked similar to the viral conjunctivitis we have been used to. So I know there's really no treatment for viral eye diseases.
Some of them may also come with epiphora, that's excessive tearing.
Okay.
Yeah, it's part of the presentation that noticed.
Okay.
Then in some animal studies, we found out that it affects the optic nerve, optic neuritis, it causes uveitic syndrome also. These have not been proven in humans anyway.
Okay.
So just like you said, redness, chemosis. Chemosis means swollen conjunctiva, then epiphora. When you have these things in a patient that you're expecting has COVID-19, then you have a high index of suspicion.
Okay. So the last question here, of course, you can agree with me that talking about the eye is not something we're going to finish in a day or in a week. It's something that is going to be a continuum. So I hope by the next time we'll call you for a second session of eye health. I hope you oblige us. So the last question I have here is on pterygium. What actually causes pterygium? Different schools of thought have talked about so many things. The first one I've heard is about pterygium occurs mostly in the northern part of the country where they have a lot of dry season and dusts and everything. And then some other school of thought talked about increased screen time as a cause of pterygium. Please, we'd like to know which one it is exactly, if both of them can actually cause pterygium, Dr.
Well, pterygium is essentially a tropical disease in the sense that it's mainly from sun and dust environment, and we know we're in such an environment. So essentially a disease that comes from sun and dust. So people in the north should have it more in that regard. People in temperate environment shouldn't be having much pterygium. So, but talking about staying in the screen, I don't know about that really.
Okay.
But I know that it's a dusty and sunny environment that causes it most times.
Dr. Nena, do you have anything to add?
Yes, as I said, it's more common in the areas that have more sunlight.
Okay.
And the people that do outdoor activities, people that work outside. So it's been said that the UV light, has some effects on the conjunctiva, causes that side of the conjunctiva, some elastotic degeneration of that part of the conjunctiva. So, but really, talking about screen time, I've not heard about that.
But you just mentioned something very interesting. You said the UV light. So what type of light do we, the phones on the screens, what type of light? Because if, for example, it's the same type of light, could it be possible that over time person might develop pterygium at some point?
Okay, UV light falls within the visible light. So, but the screen light, the light emitted from our phone screens, is the blue light. So it's a short wavelength light, and it's more penetrating and more damaging than the UV light.
Okay.
So, but it doesn't cause pterygium.
All right. Okay. So the next question now, which is going to be our final question, is about the different types of boils on the eye. Some people have boils on the upper part of the eye, lower part of the eye, towards the edges of the eye. Is there anything you can say about it? What causes them and how it can be prevented or treated?
Okay. There are different kinds of boil that one may notice in his. When you say the eye, you mean the eyelid now. It could be calasion, it could be style. Calasion is a chronic thing, and it's a swelling on the lid. It could be on the upper, even though it's more common on the upper lid. It's the lid will be swollen and it's painless. So the patient will come complain that he has been taking antibiotics and been trying to press it, and it has been there. So when a patient comes with that kind of thing, most likely is a calasion. And in the treatment, what you do is either you inject triamcinolone, that's a steroid, or you do surgery, incision and curettage, and the patient goes home and rests. But the other one, that's a form of boil too, but that one is painful. Style. That one is called style. In that one, you give antibiotics and try to express the boil, and that settles it. So the difference between a calasion, these are both swellings. A calasion is painless, a style is painful. Okay, and a calasion is a chronic thing, but style is once it happens once and goes. Okay, even though sometimes calasion gets infected, but it doesn't make it style. Calasion can get infected, and you then give antibiotics, and then still end up doing surgery for the calasion. Okay.
Thank you very much. Okay, so with this last question, we have come to the end of today's edition of the Health Corner, and we're going to thank Dr. Nnenna Ozioko and Dr. Ndubisi Amo for joining us today from the Young Ophthalmologist Forum of the Ophthalmological Society of Nigeria. Also want to thank the production crew headed by the director of the Health Corner, Dr. Grace Bernard Asado, and Dr. Chima Edoga, and the others who have worked so hard to put together this maiden edition of the Health Corner. Thank you very much. And to our esteemed listeners, I'm sure and I know that you've been impacted with knowledge. So the message you're putting out there is for you to pick up these things that we've discussed today, do the right things, and throw away the wrong things so that we can have good eye health and care for our eyes better. Remember, the theme of this year's World Days, love your eyes. Thank you very much. Join us in our next edition. Bye. Okay, welcome. This is Nigerian Medical.
Sometimes it's actually hereditary. Something like glaucoma. There are some people that it runs in their families. There are other things like retinitis pigmentosa.
The reported in patients, and then also blurry vision. So, but the majority of reports the presentation just similar to viral conjunctivitis that we use. So we know there's really treatment for viral
well, then we have to go with it's part of